One of the most common questions I get is how to know the difference between generalized anxiety disorder and OCD. And today, in this episode of Your Anxiety Toolkit, we are going to tackle this big topic together. Now, the reason that I've actually discussed this before, but the reason I want to come back and address it again is, number one, when I asked you guys what questions you had, this was the number one question over and over again. But number two, since I recorded that last episode, I myself have had experience with both. And so I would first like to discuss with you and share with you personally my experience of having generalized anxiety my entire life. And then later on, having a shift where I was diagnosed with OCD. And I wanted to share with you my experience between the two and what the difference was. Then we're going to move over and have the whole episode where we deep dive into the differences so that you feel very confident in knowing the difference and knowing what to do if you feel one resonates with you compared to the other. So let's go. Welcome back to Your Anxiety Toolkit, everybody. This podcast is about bringing you a giant virtual hug and providing you science-based, compassionate skills that will help you take your life back from anxiety and truly just be happy. That's my goal, to reduce the suffering. If we can just reduce the suffering that we experience, just imagine the change and the impact we could have. Imagine what we could get done. Imagine how much love we could give if anxiety wasn't getting in the way. Today, we're talking about the difference between generalized anxiety and OCD. As many of you know, I was recently diagnosed with OCD myself in my 40s. It was a very big shock to me. And the reason that it was a shock is because I was not prepared. I had had generalized anxiety for the majority of my life, and generalized anxiety and I were old friends. I knew every experience of having generalized anxiety. I knew what it felt like for me. I knew what to do with it. I knew how it showed up in my life. I'd done a lot of therapy about it. But then when I was hit with OCD, it was a completely different experience. Now, what I'm going to share with you is not going to be true for everybody. This is just my experience, and I'm going to share it, but then I'm going to get into the real, absolute nitty-gritty of the differences scientifically. But for me, when I have generalized anxiety, it's just this general feeling like really bad things are about to happen. It's very general. It's not specific to one thing. However, it can shift. Let's say 1 month it might be focusing on work, or it might be focused on my child, or it might be focused on health, depending on what stresses were showing up. But it just felt very general, like it was all day, every day, this low-level anxiety and stress. It sort of seeped into everything I was doing, but wasn't at the forefront of everything I was doing all the time. Sometimes, but not all the time. And it was just very sort of nagging. It's this nagging, annoying, bad things might happen. Bad things might happen. The sky might fall. However, when I started to show symptoms of OCD, the experience felt much different. The content wasn't that much different in that it would focus on one thing and get very, strong. But the difference was when I experienced that obsession, that thought, that fear, it was very intrusive. It was very, it just took my attention. I couldn't focus on anything else. It just kept nagging. It kept coming. It kept coming. It kept coming. It wouldn't stop, and it would twist and turn and make it sound even more worse and more scary and more catastrophic. Now, I'm not saying that one caused more suffering than the other, because they're just different degrees of suffering. But the experience was more aggressive when I had OCD. The voice was louder. It was meaner. It was more terrifying. It had more imagery to it. And I felt this immediate urgency that I had to try and get rid of it. Whereas with generalized anxiety, it was there and I would sort of just live my day ruminating with it if I wasn't being mindful. I could just sort of exist doing my daily thing while having the fear and trying to avoid the fear and ruminate about the fear so much. With OCD, there was this massive urgency to get rid of the fear, to make it go away, to do compulsions. And that urgency felt so strong. I wanted to get rid of that urgency so much. And so I would engage. I actually had a harder time using my tools when I was getting treated for OCD than when I had generalized anxiety and I was managing that one. Both I use CBT for. I use some ERP for both as well. I did find that I genuinely don't think I would have recovered from OCD without medication. Whereas with the generalized anxiety, there were periods of my life where I wasn't on medication and that I could function really well and handle it and manage it really well. But again, this is just my experience. And so the real difference was that urgency piece and that uncertainty piece. Both had obsessions, both had compulsions, both caused distress, both incorporated a mean voice to them. But the loudness and the frequency was different. And that was my experience. Now, the reason I share this with you is I think for people who have one or the other or both, it's important to know in our body how it shows up for us individually, because it will be different for everybody, so that we can come up with personalized strategies on how to handle it. With OCD, it's going to be very much more an emphasis on exposures and response prevention. That's going to be the main piece with that mindfulness. And we talk about that in all of our courses for OCD. With generalized anxiety, I personally tend to do a little more cognitive therapy and metacognitive therapy than I do with OCD, because OCD work, I tend to be a little more behavioral in my approach. So the treatment is a little different. In our Your Anxiety and Panic Toolkit, we talk about that, and we talk about acknowledging where the triggers are and where they're showing up in your life. What are the daily stresses? And can we navigate those stresses in the most mindful and compassionate ways so that you have an easier time managing your anxiety? Whereas with OCD, usually the triggers aren't daily stresses. They're imagined through our brain and they're created from intrusive thoughts. And so we do have a little bit of a different approach there. Both are very nuanced in their differences, but both are very, very effective. The good news here is the treatment for OCD and generalized anxiety, it's something you can recover from with the right help and the right mindset and the right amount of time. And if you're willing to just make some changes, you can recover from both. So what I'm going to do now, thank you for listening and holding space for me as I share my own personal experience. Now I'm going to talk all about the specifics in regards to the differences. This is actually an episode I released last year, so I will be re-releasing it and talking about all of those differences. And so I hope that you find it helpful. In order to get a GA diagnosis, you do have to have a specific set of symptoms, and we're going to go through them. So number one, if you have GAD, the first symptom you need to have is anxiety and worry, and that's usually focused on everyday events like work, school, relationships, money, and so on. Now, the frequency of GAD needs to occur more days than not for at least 6 months. The person needs to find it difficult to control this worry and anxiety, and it focuses on areas that are not consistent with other
mental health struggles. And what we mean by that is, let's say if the focus was on being judged by other people, well, that's better understood as social anxiety. Or if the focus of your worry was on your health, then we would actually be better diagnosing you or understanding your symptoms as health anxiety. If it was focused on a specific thing like planes or needles or vomit, we would better understand that as a specific phobia. And so, in order to have the diagnosis of GAD, it needs to not be under the umbrella of a different diagnosis. Other things that we would rule out when we're thinking about GAD is things like panic disorder, body image, or even a previous trauma. Now, the fifth symptom is it needs to cause distress and impairment. That's very, very important here because, again, we're talking about a disorder. What that means is a lack of order, no order. And so what we want to see here is that it's highly impacting their daily life, highly impacting their ability to function. And then the sixth criteria is it has to be ruled out that these symptoms could be from a medical condition or substance abuse. An example of that might be even me with POTS. I have postural orthostatic tachycardic syndrome. A lot of the symptoms of POTS can actually look a little bit like generalized anxiety. The seventh criteria are the specific symptoms. And this is important to recognize because this might be true of a lot of different situations, symptoms, diagnoses, medical and mental. You need to have symptoms such as restlessness or being on edge. You need to be either easily fatigued, difficulty concentrating, or having what we call a blank mind. You might have irritability, you might have muscle tension, and you could also have sleep disturbances. So that is the breakdown for GAD. As I said, it's very easy to mix it up with other mental health disorders such as OCD because they can look very, very similar. So let's talk about OCD now. What is OCD? Now, in order to understand what is OCD, we need to again address the specific criteria to get a diagnosis of OCD. So symptoms of OCD include the presence of obsessions and compulsions, or one, right? So sometimes, again, you might have obsessions without the compulsions, but usually at the onset of the disorder, you will have both. You will also have intrusive, unwanted, repetitive thoughts, feelings, sensations, urges, or images. And these cause a very high degree of distress and anxiety, as we mentioned with GAD. The individual with OCD will often attempt to avoid or suppress these thoughts, feelings, sensations, or urges, and they will try to neutralize them using what we call compulsions. Now, there are 5 different types of compulsion. Okay. A lot of you who followed your anxiety toolkit will know about these compulsions. We've talked about them. We actually go over them extensively in our online course for OCD called ERP School. If you're interested to learn more about that, you can go to cbtschool.com. We have a whole array of courses there to help you work through this and get help if you don't have access to treatment of your own. So we do have 5 different types of compulsions. The first one is avoidance. The second one is mental compulsions. The third one is reassurance seeking, whether it be from Google or a loved one. The fourth one is physical compulsions like checking or jumping over cracks or washing your hands, just to give a few examples. And the last one is self-punishment, right? So there are 5 types of compulsions. Now, these compulsions are not connected in a realistic way to what they're designed in the way that they're designed to neutralize or prevent. They're usually clearly excessive behaviors done repetitively and done usually from a place of not wanting to do them, but more that the person with OCD feels like they have to do them to reduce or remove their obsessions. Now, the obsessions or compulsions are time consuming. And so the frequency here is that they need to take up more than 1 hour per day or cause a significant degree of distress and impairment on their social, occupational, or other areas of functioning in their lives. The next criteria is that the obsessive compulsive symptoms are not attributable to physiological symptoms or substance abuse or a medical condition. Similar to GAD, again, we want to always check for medical and substance abuse issues before we go ahead and get a diagnosis of either GAD or OCD. And then last of all, that the disturbance is not better explained by another mental health condition. Again, if the worry or the obsession is around needles, like we talked about before, or being judged by somebody else, or health conditions, well, if that were the case, we would give them a different diagnosis. Okay. Now, this is also true for trauma. Again, I want to make sure we understand that often this same cycle will play out in different anxiety disorders, PTSD, BFRBs, phobias, health anxiety, BDD, body dysmorphic disorder. So once we have ruled those out, we can then move forward and acknowledge that this might be OCD or it might be GAD. So now that we've gone through all that, we can actually slow down a little and really take a look and talk about OCD versus GAD and how to tell the difference. So let's break it down. Both GAD and OCD have intrusive thoughts, or what we call an obsession, right? A repetitive thought. Now, both have the presence of rumination compulsions and reassurance seeking compulsions, right? That is true for both conditions. OCD tends to be more on irrational topics and subjects, whereas GAD tends to be more focused on daily stresses and rational actual events in the person's life. But not always. Again, sometimes the person with GAD may engage in a lot of catastrophic thinking or irrational thinking that can actually make this disproportionate to their daily life stresses, right? Questions that you might want to ask yourself when you're considering how to tell the difference between GAD and OCD are questions like, are your worries related to a daily stressor, right? Or are your fears intrusive and repetitive? People with OCD tend to identify that their thoughts are very intrusive, that they can't stop them, they're relentless, they repeat themselves over and over, whereas people with GAD tend to find that these are more preoccupations with problems in their life and they're trying to solve them, right? Another question to ask is, are my fears realistic and valid, or are they irrational and distorted? That question too can help us differentiate whether your symptoms are more related to OCD or GAD, right? Another question to ask is, does anyone in your family have GAD or OCD? We know that these conditions are very, very genetic. So if you've got someone with OCD in your family, it might actually help us to determine, is this something that's going on for you? Are you better understood as having symptoms of OCD than you are GAD? Right? Another question or thing you might want to do is you can take a GAD or an OCD test. So we have specific diagnostic tests that can help determine these. And I strongly encourage, if you're still having a hard time differentiating after you've listened to this episode, please do go and speak to a mental health professional who can help you determine and do those tests so that you can really be clear on what you've got and help you get the correct treatment, right? Let's sort of answer some questions about this topic that commonly come up, which hopefully will help you get even more clarity on this topic. So one of the most common questions we get asked in this area is, can you have OCD and GAD? Often some of you are looking at these criteria going like, yes, 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 yes. And the truth here is, yes, commonly people do have OCD and GAD. There is a very strong GAD OCD overlap here. So it could be that you have both. The good news here, if that is the case, is that the treatment for GAD and the treatment for OCD are very, very similar. In fact, again, like I said, it's very controversial. Some clinicians say it doesn't even matter. We don't have to differentiate between OCD and GAD because the treatment is going to be so similar. We're going to use a combination of cognitive behavioral therapy and exposure and response prevention. We call cognitive behavioral therapy CBT, and we call exposure and response prevention ERP for short. And those treatments are focused on reducing those safety behaviors or compulsions, such as rumination, avoidance, reassurance seeking, physical compulsions, and self punishment, and also encourages you to identify your fears and learn to face them as much as you can. Learn to navigate those fears by experiencing them, tolerating them, being kind to yourself as you ride the wave of distress, and practice mastering your ability to be uncomfortable, right? That's a huge piece of this. Also, master your ability to be uncertain, because in both conditions, they often require you to spend a lot of time trying to seek certainty, to get clarity, to solve the fear, prevent the fear. And we actually instead work at reducing that by increasing our willingness to be uncertain. What about other anxiety disorders versus OCD? Well, what we've talked about already, hopefully we'll clear that up, is the real way to determine what your specific problem or struggle is what is the focus of your intrusive repetitive thoughts. Again, if it's on your body, and your body image, we would look at an anxiety disorder or an eating disorder, or maybe even BDD. If the focus is on your health, we're going to look towards health anxiety or hypochondria. If your fear is around being judged, we're going to look towards social anxiety. If your fear is in response to an actual trauma you've been through, we're going to look to PTSD and other trauma symptoms that you might be having, right? So it's important to identify the core fear, and that can actually help determine what specific struggle and diagnosis you have, right? Another important question that people ask is, can GAD lead to OCD? We don't actually have a lot of research on this. So it's important that we recognize that yes, they can overlap. That yes, you can have GAD and then you can proceed into having OCD. But I wouldn't actually say that GAD leads to it or causes it. Usually, again, OCD, we don't really have a lot of clarity on what causes OCD, but we do know that there is a genetic component and an environmental component that is contributing to having OCD. Lastly, what's the difference between having OCD and general anxiety, or just anxiety in and of itself? And often, again, we're going to look at that core fear, right? Now, the thing to remember here is everybody has anxiety. Everybody experiences anxiety. It is a normal part of being a human. But if that anxiety is starting to impact the functioning and quality of your life, if it's starting to take up a lot of time, if it's starting to stop you from being able to do the things you want to do, that's usually when anxiety becomes what we call an anxiety disorder. And when that happens, I'm going to urge you to seek help. There are treatments, there are solutions, there are practices that can help you overcome this anxiety and get you back to living the life you want to live. We don't have to live a life where we just accept anxiety at this rapid rate without getting help and skills and tools to help you move forward. The whole reason I created Your Anxiety Toolkit is because there are tools that can help you navigate anxiety in the most effective, wise, and kind way. And so my hope here is that today, as we've learned to differentiate the difference between GAD and OCD and even other anxiety disorders, you can then go to get resources to help you overcome those specific struggles and challenges. Again, if you're interested, please go to cbtschool.com. We're also here on Your Anxiety Toolkit, where we have over 350 free episodes to help you also navigate these conditions. It is an honor and pleasure to help you with these struggles in your life, and I'm so grateful to be able to do that. And so I hope that's been helpful. Have a wonderful, wonderful day, and I'll talk to you soon.